Before we start, we'd like to acknowledge the Turrbal and Yagara as the First Nation owners of the lands where QUT now stands. We pay respect to their elders, laws, customs, and the creation spirits. We recognise that these lands have always been places of teaching, research and learning, and acknowledge the important role Aboriginal and Torres Strait Islander people play within the QUT community.
Orbital band syndrome, also known as ITBS, is a common knee injury. It is caused from inflammation of the distal portion, which then leads to lateral knee pain. The orbital band is a thick band of fasciae that crosses the hip joint and extends distally to insert on the patella, tibia, and biceps foris tendon, which is a group of fibers that run the length of the upper leg, from the hip to the top of the shin. Orbital band syndrome is very apparent among athletes, most likely athletes who are continuously running or repetitive knee flexion and extension. Some athletes who are more than likely to come across ITBS include long-distance runners, cyclists, volleyball, tennis, soccer, and football players. Within being diagnosed of orbital band syndrome, many patients experience different degrees of severity. Most of the common symptoms include sharp or burning pain just above the outer knee, pain that worsens with a continuous of running or repetitive activities, swelling over the outside of the knee, and pain during early bending. Aching, burning, tenderness, click, pop or snap, pain up and down the leg, warmth, redness, and if untreated, IT band syndrome can cause scarring in the bursa. To identify tightness of the orbital band syndrome, the Bursa's test is usually used. The Bursa's test is a physical examination when the patient lies on their side with the unaffected leg on the bottom with their shoulders and pelvis in line. In severe cases, magnetic resonance imaging may be helpful in identifying the extent of the inflammation of the ITB. Findings on MRI most commonly include thickening of the ITB in the region overlying the lateral femoral condyle and fluid collection underneath the ITB at this area. The same tied injury prevention device isn't always going to cure an IT band injury. Instead, proactive and intense injury treatment is needed to get a healthy cure for your ITBS for good. Orbital band syndrome is classed as an overused injury. It is caused by alternated running biomechanics due to an underlying muscular imbalance. The individual's biomechanics can change due to a muscular imbalance, factile, and ground impact issues. Results from repetitive friction between the ITB and the lateral femoral epicondyle as the femoral band moves knee movements during. ITB is regarded as a friction syndrome where the ITB rubs against the lateral femoral epicondyle. The lateral thickening of the fascia lata in the high splits to the superficial and deep layers, enclosing the tensor fasciae latae and anchoring this muscle in the ischial crest. Overall, being viewed as a band of dense fibrous connective tissue that passes over the lateral femoral epicondyle and attaches tubercle and to the anterolateral aspect of the tibia. The importance of further study for orbital band syndrome is highly needed, as ITBS is viewed by many as a failed healing. Many studies are occurring to test the inadequacy healing process for ITBS. There are numerous cases of ITBS, and not only elite athletes, many cases where they're just daily activity, physical activity. However, there is a low percentage of patients that are fully healed. Corey Bales studied to review treatments for ITBS within athletes. He chose 10 studies that were attentive to all and all needed to be reviewed for further study for treatments. Corey Bales used both conservative and surgical treatment options within his study, but both had the outcome of further research needed to ventilate and true pathophysiology of ITBS. This then insinuates that further study is needed for an outcome healing process is needed.